there, it's Kathy Cates and Melissa Hines from the Institute for Pelvic Health.
And you're watching Demystifying the Pelvic Floor, weekly videos providing real and simplified pelvic floor education for real clinical situations. We've got you covered.
And today we'll be talking about the importance of postpartum pelvic floor evaluation. So, as a pelvic floor therapist, I am like, oh my gosh, everyone needs a postpartum pelvic floor evaluation by a pelvic floor therapist. It's so beneficial and empowering for the patient because a lot of times they'll feel so like, oh my God, my body was destroyed from this pregnancy and delivery. And if they see someone and know exactly what's going on with the muscles specifically and what they need to work on, and it may just be a couple things that they need to do to help heal, it's so helpful for them. And it takes away a big stress and an unknown. So generally we love to see people at 6 weeks after they've had that 6-week follow-up with their OB or midwife. Now, Kathy is an NP and someone doesn't have access to a pelvic floor therapist. What do you think is kind of crucial?
Totally. So as both the pelvic floor therapist and the NP who has been in those situations where you only have 15 or 20 minutes and your patients don't have access to a pelvic floor therapist, it's such an important question, Melissa. So the biggest things are checking for, making sure there aren't any signs of infection. That's the first thing. And that's something we're all comfortable with. I think the thing that we can do and that is of the utmost importance is really, are you assessing their pelvic floor tone, right? And so just do a really detailed, thorough, take your time. It doesn't take that long, and really go around all of the pelvic floor muscles, right? And like, do any of them feel tight or tense, or just some of them feel lax, right? Because I think the biggest mistake we do is to hand the postpartum patient, the handout from the EMR that says, just start doing Kegels, right? So I think it's really up to us to assess the pelvic floor muscle tone. And, Melissa, it's been fun to do some bimanual exam videos with you. So we won't go into it here, but you guys can go back and take a look. And I also think the motor control, right? Like, you want to ask somebody to, like, with your finger, 1 or 2 fingers in, up to you, squeeze around your fingers, right? And what do you feel?
Yeah.
Yeah.
And I think that it goes beyond more of just assessing prolapse. It's like, okay, well, if they have a mild prolapse, what is something that you can do to help them? It's assessing the motor control, because then right then and there you can say, here's what I want you to do to help with this, instead of being like, oh, you have a mild prolapse, that will get better over time.
Right. Because nobody wants to hear that.
No one wants to hear that.
Right. That's so hard, right?
Totally. So,
yeah. And the other thing, Melissa, I was wondering if you could just chat about the importance of, and I know, like, all of my patients, whether it's in clinic with you or in clinic at the federally qualified health center, no one's talking to them about moisturizing. So could you maybe enlighten us about the connection between the pelvic floor muscles in particular and moisturizing?
Yeah, so I think it's important to know too, like, we think of, okay, for postpartum, low estrogen, vaginal dryness, okay, some moisturizing. But it's also for people with any sort of tearing. It needs moisture in order to heal. So we love talking and educating patients after we kind of allow that area to heal for 6 weeks, and then we have them start with vaginal moisturizing, and that can be from vitamin E applied both topically around the vulva, vestibule, and internally a little bit, to we love V Magic, Vital V. These are all great moisturizers, and especially doing some self perineal scar mobilization with the moisturizer to really help heal. And it also provides such a soothing effect too on that whole area.
And I feel like it doesn't take more than just a few minutes to really teach your patient So, for those of us in settings where you have maybe 20 minutes, you can do everything that we're talking about. Sure, it's great if they can see a pelvic floor therapist, and we totally encourage that.
Yeah.
We don't want people to be dissuaded, because you can really do a lot of this in 15 or 20 minutes and get people started,
Yeah.
right? People just want something to start.
Yeah. All right. And that's a wrap. Did you like this video? If so, hit like and subscribe. Please share with your colleagues and comment below to let us know your biggest challenges with evaluating pelvic floor muscles on postpartum.
And subscribe to our email list at instituteforpelvichealth.com to get your free guide, 4 tips for managing your challenging pelvic exam. You'll get access to our free weekly pelvic health content too.
And be sure to find us on Instagram, Facebook, and LinkedIn, where we'll post more pelvic health tips. We're super excited to announce we're creating an online pelvic health course for nurse practitioners that will be launching this fall.
Our course will break down the pelvic floor so that you can confidently care for your patients with pelvic floor dysfunction. By simplifying the pelvic floor, we'll improve patient outcomes and your provider experience. We're going to fill that knowledge gap that we all have from school. Thanks for watching and spreading the word. Let's revolutionize pelvic health. We'll see you soon.